Hi, this is Nora De Silva. Today's episode is about infertility. According to the reports from the United Nations for 2023, 1 out of 6 people is affected by infertility. I am honored to have with me today Dr. Essam Michael. He is an obstetrician and gynecologist, and he is a specialist in fertility problems. He is the CEO, founder, and director of Astra Fertility, a group since 2004. Hi, Dr. Michael. How are you doing?
Hello, Nora. How are you? Thank you for having me.
Thank you so much for accepting the invitation and coming all the way to share your wealth of information and infertility with the audience.
Thank you very much.
What is infertility?
Well, in simple terms, infertility is a difficulty to achieve a pregnancy within 1 year of trying. Okay, provided, of course, that the female have regular cycles, and provided that we have regular intercourse at least a couple of times a week on average. Having said that, you don't have to wait for a full year if you are older, and when I say older, I mean 38 years of age or older, because we don't have the luxury of time here. You want to know quickly what's the problem and try to be on top of things, and you want to achieve a pregnancy usually within 6 to 8 months from seeking fertility care.
How does lifestyle affect infertility? Exercising, dieting?
Well, as you said, we are seeing more and more difficulty conceiving these days, and there is no family without someone who have some issues related to fertility. And lifestyle, like choosing to start a family late, that's one of the biggest reasons why people having issues. This relates to egg fertility potential, which normally decline with age. That's a big one. Lifestyle, gaining weight, BMI above 29, 30, usually associate with some ovulatory dysfunction because, again, it interferes with the signaling coming from the pituitary gland to the ovaries to make the ovary work well. The ovary is like a basket of eggs waiting for the right signal coming from the higher centers of the brain to start maturing and releasing to meet with the sperm in the tube. And obesity can affect this signaling and cause hormonal imbalances. Okay, stress work at the same direction, in a sense that if the signal that come from the brain to the ovary are not perfect, ovulation does not work. Also, sperm production will not be good. Okay, so lifestyle definitely will have a big impact. So we have to eat well, sleep well, don't gain weight, exercise. All these are important basic health issues, and we have to follow a healthy lifestyle to be able to be healthy and can have a family as well.
What about smoking and
drinking, drugs,
like
all that?
Consuming alcohol and
100%.
drugs? Yeah.
Yes.
Yeah. Okay. What are the common causes for infertility, both in men and women?
For women, one of the commonest is ovulation dysfunction. They don't ovulate good. Polycystic ovary syndrome is one of the common ones. Tubal factor, if you had previous pelvic surgery or pelvic inflammatory disease, this can also affect the tubal ability to function, connecting the sperm and egg. So these are the two main reasons that cause female infertility: ovulation dysfunction and pelvic/tubal factors. For men, sperm counts and sperm motility and sperm shape has been going down over time. And again, we don't know exactly why, but this is a common observation, and lifestyle is important. We notice that occupations that require sitting for a long time, truck drivers, IT people, because they sit long hours, it increases the temperature of the scrotal area, and that affects sperm production. So lifestyle plays a part as well. Of course, there is some genetic factor, smoking, overweight, all that can affect sperm counts. So declining sperm counts actually almost half the couples that coming to us will have some sort of male factor. Yeah.
What are the different fertility treatments available?
Well, fertility treatments, there is a lot of treatments available. if you are talking about just to list them, but the treatment really depends on the underlying diagnosis. Like lots of treatments can be solved or can be offered by surgery. Okay, somebody with a submucosal fibroid sitting in the cavity of the uterus that need to be removed. And if you remove it and everything else is fine, that's all what a couple would need to succeed. Sometimes there is tubal factor, tubes may be blocked, and we can either correct that by offering laparoscopic procedure, which is a day surgery where you look at the tubes and have a definitive diagnosis and see if it is correctable or not. Do you have adhesions? Do you have a blockage of a tube? And is it proximal blockage? Is it distal blockage? Because the treatment is very different related to the location of the blockage. IVF definitely is a good treatment if the tubes are no good, because it is a substitute. Sperm and egg can meet in the petri dish outside the body in the lab and observe the embryo for the next 5 days, select the best one and replace it back to the uterus. Again, all this should have been done by the tube, but IVF offer a great alternative for surgery if you have significant tubal factor.
Okay. What is the success rate for each type of treatment?
Well, the success rate naturally, if you have no problem as a couple, both the male and the female are perfectly healthy, is about 20 to 30% per cycle depending on their age. Okay, so any fertility treatment, whether it is ovulation induction or IUI or superovulation, will take you to that same natural fertility level. Only IVF can give you double these rates. And why is that? Because IVF has a big advantage, which is collecting a huge number of eggs in one cycle. Okay, normally any female releases 1 egg per month. So if that egg is not perfect, the whole month is gone. Okay, no chance to conceive. IVF offer you 15, 20 eggs in one go, in one cycle. And this is why IVF is so successful, because it compresses the chances of 1 year in one cycle. So IVF give you 50-60% pregnancy rate per transfer, at least. IVF will not work good if your eggs are not good. Meaning, if you are over 40, for example, not all your eggs that we're going to collect will make embryos, and not every embryo will become a baby. And that's why when we stimulate the ovaries, we try to get the best out of that stimulation, because you need good quality eggs and good number of them.
Is there any way to make the eggs quality good?
No.
Like vitamins?
No.
No.
No. I know lots of things on the internet, acupuncture, supplements, CoQ10, DHEA. They don't work uniformly, and I'm not convinced really. Okay. You can try them as long as you can afford them and they will not harm you, that's fine. Yeah. But in reality, egg fertility potential is something that you cannot change. Okay, why? Because females are born with a good number of eggs, and that number keep declining as you get older till it's finished. And what happens is that the good one leave first. They graduate first, so you are left with less and less quality over time. Wow. You understand? Okay. So there will be some points that there's no good quality eggs, and people try 1 and 2 IVF and the same results, even with different types of stimulation, ovarian stimulation, I mean. And these people has to be offered either egg donor or donated embryos, or maybe that's it, we're going to stop here.
Well, now I understand why women, if they get pregnant after 43, 45, like they say the baby might have some difficulties or born with some
or will not happen. Nature will stop it.
Because the egg quality is not good.
Exactly right.
The left is not good.
Whatever left in your ovary. But everybody's different.
But this is in general.
Yes.
In general.
You hear about somebody 47 had a baby without even IVF. It happens, but this is exception, not the rule.
Okay.
You understand?
Yeah. What is the difference between IVF and IUI?
In vitro fertilization means the sperm and egg, instead of meeting in your tube, they meet in the IVF lab. Yeah. Okay. And IUI is artificial delivery of the sperm, intrauterine insemination, or delivering the sperm directly inside the uterus, bypassing the areas of huge losses like the vagina and cervix. And it is good or really indicated when you have low sperm numbers. You cannot afford to lose a lot in the vagina or the cervix. So you give the sample to the lab extract all the good sperm from the semen, and artificially will put it through the cervix with a fine plastic tube to help them. We're cheating a little bit to help them to reach the final destination. Okay, so that's what IUI does. But again, it just restores the natural fertility again. It does not make you super fertile.
Okay.
If you want to make a woman super fertile, especially if you are 38, 39, we try to release multiple eggs. Instead of 1 egg per month, we give medication to release 3 to 5 eggs. Of course, whenever you do that, there's a risk of multiple pregnancies. So we don't usually start with that.
Okay.
But before IVF, I do offer patients super ovulation, with or without IUI.
Okay.
Okay, but if they're not successful in 2-3 months, that's it. Provided that they responded well to the medication, though.
Doctor, you are specialized, as I mentioned earlier, in endometriosis. What is endometriosis?
Endometriosis is the presence of a tissue similar to the endometrium, which is a lining of the uterus that builds up and shed every month. That's how a woman gets a period. Tissue similar to that somehow migrated outside the uterus and implanted on the pelvic structures. The ovaries, the tubes, the bowels, the bladder, sometimes even go further away, go to the lungs, and it can spread to distant areas. So how does it get there? Nobody knows, but one of the theories that explain how the endometrium traveled to the pelvis is going through the tubes backwards. So a woman gets her menstruation, instead of everything going down to the outside, some of it shoot up. Okay. We found that this happened in a lot of women, actually, but not everybody with retrograde menstruation has endometriosis. Okay, it depends on the immune system of the woman, her hormonal conditions. All that can allow these little pieces of endometrium to implant and get stuck to the surface of the ovaries and other structures. And over time, they can start their own blood supply and even grow. Okay, and they undergo the same changes like what happened to the endometrium, meaning when you have a period, the endometriotic implants also bleed in the wrong place, and that's what causes the inflammation. Okay, blood, when it breaks down to get absorbed, like when you have a bruise, the area becomes sore for 2 or 3 weeks, then absorb and everything back to normal. But in endometriosis, this is renewed every month, so it's a constant irritation, constant inflammation. So it causes infertility by creating adhesions, scar tissue around the tubes and ovaries, interfering with the egg travel from the ovary to enter the tube, creating chemicals that are toxic to the sperm, egg, or embryo, and also makes the immune system sometimes overactive, and it may regard the embryo as a foreign entity and attack it. Because the embryo is a foreign entity, actually. Okay?
Okay.
Yeah.
Wow. Okay, so it is not an infection, but it causes
Cause a chemical inflammation. Not inflammation by infection.
Okay. And how to treat endometriosis?
Endometriosis treatment for fertility, of course, treatment of endometriosis depends on what are you trying to do here. Is it pain, or it's just fertility, or both?
Let's say pain first, then infertility.
Well, for pain, you simply stop the periods, but that will not help fertility.
Okay.
Lots of drugs to help that, like progesterone-like medications.
Okay.
Lupron, which is a drug to turn off the signal from the brain to the ovary, like creating an artificial menopause.
Yeah.
Some progesterones that make a pseudo-pregnancy.
Okay.
That will stop the pain.
Okay.
Okay, but will not help your fertility at all, because you're not going to ovulate when you do that.
Yeah. How many types of endometriosis are there?
Well, it's not really types, it is stages of endometriosis.
Okay.
As I said, endometriosis is the presence of a tissue similar to the endometrium in the wrong place in the pelvis. And it can be minute little spots of endometriosis, that's mild. Can be a bit deeper and bigger lesions, with or without scar tissue. Once you get to scar tissue formation around the tubes and ovaries, or blood collections on the ovaries, become stage 3 and 4. And it also can deeply invade the tissues it is on. That's called deep infiltrating endometriosis, and that's the most painful one.
Which is called severe endometriosis as well?
Yes.
Okay. How to treat endometriosis?
As I said, the treatment depends on the goal of the treatment. What are you trying to achieve?
Okay.
Fertility, just control pain, or both. If it is pain, use medication to stop the period.
Okay.
Either create menopause-like condition or create a pregnancy-like condition using progesterone. Okay, so to stop the period basically, and that will help the pain because, as I said, the blood is what creates the inflammation. So if you stop the bleeding, all this inflammation will subside.
Okay.
Okay, if you want to do promote fertility, okay, you need to look with the scope. You need to remove any adhesions around the tubes and ovaries. You can burn or destroy the endometriotic implants without compromising the function of the ovaries. So you have to be careful when you do the surgery. You should have the mindset of function preservation over eradicating the disease. You don't have to remove all the endometriosis to say, I want. No. If you do that, sometimes you compromise the blood flow to the ovary and you can cause ovarian failure, which again, counterproductive. So the reproductive surgeon has to balance the risk of reducing fertility versus the risk of, or the advantage of removing the endometriosis.
You do that through laparoscopy?
Yes.
Okay.
It's a laparoscopic surgery. It can be difficult, can be long, but again, the goal is to restore the anatomy mainly and to reduce the amount of the disease. Don't have to remove all the disease.
And in some cases, like after you do the laparoscopy, as you said, there is a severe endometriosis. The endometriosis comes back in 1 or 2 months. Then I think maybe if they do the in vitro, IV in vitro, then they do Lipron depot for 2-3 months. Then they inject the in vitro inside the uterus.
Severe endometriosis, if you know that the patient has severe endometriosis, definitely IVF is superior to surgery. Okay, because also if you do surgery, you're not going to do surgery every few months. Just one go at it if it's going to be beneficial. So you do IVF, you freeze the embryos, and if you know there is active endometriosis causing inflammation, patient still has pain, all that stuff, you suppress the endometriosis for 3 months with drugs, and then do the embryo transfer before she starts to have her periods again. And this way, of course, you may have a higher success rate.
What is the invasive minimal surgery?
Minimally invasive surgery is surgery, but done through tiny little incisions. So with minimal access, like small incisions, like keyhole incisions, the belly button, lower abdominal wall to get access to the pelvis and operate. The advantages are that you can do anything you want, like opening the whole abdomen and doing surgery. Actually, you can do better because you see better with the laparoscope. So actually, you achieve better success with your laparoscopic surgery or the minimally invasive surgery. And patient recovery is very quick. Patient go home the same day and go back to work within a week or 2 at the most. So that's advantages of minimally invasive surgery. Minimally invasive surgery also is surgery on the uterus to correct uterine abnormalities that are very important to correct before natural pregnancy or any fertility treatment.
What is the reproductive surgery?
It is more or less, there is a big overlap between minimally invasive and reproductive because reproductive surgery are all minimally invasive. Okay, so you do hysteroscopy, looking inside the uterus to correct uterine factor, as I said, fibroid, polyps, adhesions, Asherman syndrome. Laparoscopy for endometriosis. You can do tubal reanastomosis for people who had tubal ligation before through the laparoscopic surgery. Distal end of the tube that's blocked, you can open it, salpingostomy it's called. So you can do a lot with the laparoscope, but you have to be selective also. You have to consider the patient age into the account, her ovarian reserve, is there a male factor or not. So you have to know the whole story of the patient to see which treatment does make sense. Yes.
Yeah. Is IVF covered by OHIP?
The fertility program started in Ontario in 2016. It is covered by the Ministry of Health, yes. You have to be a resident of Ontario, you have to be less than 43 years of age. And they cover 1 cycle. And 1 cycle means 1 egg collection with the transfer of all the embryos that are generated from that collection. So if you're lucky and you have 10 embryos, you'll have 10 tries covered.
Okay.
If only 1 embryo, gone.
Okay.
If you have no embryos, gone.
Gone. Okay. So
It's one go
trial.
at it.
Okay.
That's right.
So
The downside or the limitation of that program is that the funding is limited. So the number of IVF covered, offered to fertility clinics is way less than what patients need. That's why there's a long wait list. And it is a dilemma to who to offer the IVF for. It's covered. Everybody thinks they are urgent.
Yeah.
And they're right. That's from their point of view. But
for sure.
we have difficulty, ethical and emotional difficulty deciding on that. And we'll try to do it first come, first serve. But you get somebody who's going to be 43 in 6 months, and if she does not get the coverage, that's it.
Yeah.
So it is tough.
How do you help couples emotionally?
We help couples emotionally by setting the expectations right. So you have to tell them what's the natural fertility rate. Fertility treatment only restore that natural fertility rate, which is 20-25% per cycle at best. So don't say, oh, my IUI didn't work last month, what's wrong? Well, success rate is only 20%. Well, nothing's wrong, but it's true, we have to look at the cycle. Maybe something needs to be tweaked. By setting the expectation, that gives them some relaxation, and you just want to know what's ahead. They want to know what if this doesn't work? What's next for me? And why it's not working? When you don't give them a diagnosis, tell them your diagnosis is an infertility. Infertility is not just a diagnosis. Your mom can tell you that you have infertility, but you want to know why. Okay, so part of the anxiety is that they don't know why are we doing this? What does this offer me better than me trying on my own? Okay, and they think sometimes that IVF will be the answer. Not always. Not always. Not always. You have to be careful about that. So by setting the expectation, being on the same page as with the team as a whole, everybody should be compassionate and should know in their mind that we're all here to help you to get pregnant and be happy. We're all here for your happiness. Not everybody will get pregnant too, by the way, and this is a fact. Sometimes you have to go to different things like donated eggs and donated embryos. But at least they have to feel like we did everything we can and we've been honest with them, explaining things. So counseling also is important. Some people need professional counseling just to help them go through this difficult journey, full of bumps in the way. So it is tough. But it is very rewarding when things work.
It's worth it. It's worth all the wait and all the efforts.
100%.
Yeah, exerted. Thank you so much, Dr. Essam Michael,
no problem,
for coming and sharing your wealth of information. I am honored to have you. I am honored to have an Arabic doctor who came from Egypt to Canada. He is helping people on a daily basis to improve their lives, to be happier, and you leave a fingerprint, in our society. I am so thankful to you. You have helped me myself. I came to you 11 years ago. I couldn't be pregnant. You helped me, and my first son was born, David, and the offer was buy one get one free. So David come with an IVF, but Miriam happened naturally.
See? See? Things, we don't need a doctor all the time.
Okay, no, but you helped me, I have to say that, And I'm really thankful for your coming tonight to the show.
Thank you.
To tell the people all the information you have already mentioned.
Thanks so much.
Thank you so much.
Have faith, everybody.
Yes, have faith, everybody. And guys and girls, thank you so much for watching us today. I hope this episode will benefit you. And if you have any infertility problems, please go and see Dr. Essam Michael. He is one of the best. He is a wonderful doctor. And until next time, stay tuned. That was Nora De Silva. Thank you.